What is medical negligence?
Human is an error. It can occur anywhere with anybody. That is a negligence, but will not be counted in the error of the doctor.
Good morning, Dr. Sam.
Good morning, madam. You're welcome here for my interview about my profession.
Thank you so much for joining us today. Could you please tell us something about yourself?
Yes, I'm Praveen Jain, an allopathic doctor with a degree of MBBS, Bachelor in Medicine and Surgery. I have taken a diploma in pre-marital counseling from Women Association of Delhi, that is Women Commission of India. Okay, and I'm practicing here since 46 years. The right this place only, and you see, I have tackled the problems of the patients in and out with a lot of experience over these years in society and patients and doctor interactions.
That's very nice. Dr. Saha, what is medical negligence?
You see, when we talk about a word negligence, then you see negligence can mean many things. A doctor is always contributing his best because he has studied, worked hard, he is talented, he has grown so many years in practice. So experience really counts for his practice part, you see. And when we talk of negligence, you see, human is an error. It can occur anywhere with anybody. But negligence, when it is with a sensible cause or without knowledge, are two different things. And then negligence, we will say that a thing has happened in two ways. Without the knowledge, it can be in two ways. Number one, you know a thing has happened because, like an example I will give you, that an injection has to be given with the testing. I have not tested thinking that he will not react. Or I have given medicine to patients not asking whether there is allergy to any medicine or not. That is one negligence that I have avoided by knowingly. Unknowingly, if I give an injection which it works, but for betterment I change the injection next time, that is also safe for thousands of people, and there is a reaction. So that is a negligence, but will not be counted in the error of the doctor, because that has happened without his knowledge of the things, how the patient reacts. So negligence is not always negligence as is insinuated or is said.
So, Dr. Sahab, the doctor's intent is absolutely clear when the doctor gives the injection,
Right.
thinking that it wouldn't react, but it reacted. So, how should an individual see it? Should an individual consider it medical negligence, or should an individual talk to the doctor and let him go?
You see, whenever we administer an injection to the patient, we always ask whether he wants that injection for this purpose, how much important it is to be given to him. Unnecessarily we don't inject. And those injections we don't inject in our clinic, which can cause allergy to the patients, usually. You see, like thiamine, in vitamin injections, and they will be avoided. Even if patient brings the injection, we will not administer it because that can lead to reaction. But many times you've seen after giving a test dose, reaction has occurred. We have saved the lives, but it can be a very difficult situation when you see what the doctor will do as a negligence. Is it a negligence? I think it is not, because testing has been done.
Absolutely.
And reaction has occurred.
Yes.
What the doctor can do?
Yeah.
Will he leave the practice or will leave an ethical practice?
Absolutely. So, Dr. Saab, if a person feels that there has been a medical negligence, what is the best course of action the person can take? How can the person find out whether it is negligence or not? As a doctor, you can say that it wasn't a negligence or it was a negligence,
Right.
because you have the knowledge. But how should an individual find out whether it was negligence or not?
You see, a doctor and patient relationship is a relationship of faith. Doctor is contributing his mind with full emotions, full sympathy with his disease or illness, trauma, and he is trying to contribute to fairness or happiness or correction to his illness, you see. He is doing his best effort all the time, day and night. The question is how he will know. You see, one thing doctor comes to know about some mishappening has occurred on his part, then he will definitely will fear in his mind for the time being, if the patient is absolutely okay, and then he will correct it for the future. That is the experience of practice. And patient doesn't need to know it all the times. But if he comes to know about it through the doctor of himself, then that can be corrected later on for future people. And we can make them understand a mistake has happened and that will be corrected, that was done so, and we will learn from that, not to do it, not to repeat it in the future.
Absolutely. Dr. Sahab, as per the new rule, if medical negligence leads to the death of an individual, then the medical practitioner may be imprisoned for 2 years. What's your opinion?
Actually, you see, doctors come in the picture of the society after a lot of studies, lot of talent, lot of, you see, hard work and experience. See, anything can happen. If it is a criminal act by a doctor or non-doctor practicing as a doctor, as cracks do, and their chances of death is imminent. It can be many times, you see. But death as a word is very bad. If it happens somehow or the other, it is bad for the doctor and for the relative of the patient. It must not happen for the first time, the first place. Secondly, if it happens, you see, the authorities come in the picture and they have to see whether the criminality has been done, or some negligence has been done, or nothing is there because it had to happen if the patient was so ill or so sick. So depending upon that has to be decided by the authorities. And accordingly, doctor can be, you see, can either compensate the patient or he can correct it for the future and can be given a red card that you are the person for it for the future so that he can reform him. If chance is given for him to reform, that must always be the first thing. And if there is damage done to the patient, he asks for the compensation. You see, there are authorities that are helping him. He can go to IMA, he can go to DMA with the case, he can go to BC, you see, in various places where there is consumer courts.
Yes.
Consumer courts. They are there for compensation. It is real. For many people are making false claims. That is another very bad thing.
Okay, so you feel that
Yes.
people are also making false claims.
Yes.
It's not always the doctor at
Not
fault. In
important.
fact, people are making false
Yes,
claims.
many cases are coming like that because advocates get mixed with them and they join them that we will get you compensation to their benefit. Thereby doctors are unnecessarily coming in the picture, though they are not at fault.
Okay. Dr. Sahab, others of medical negligence which are filed in India, and you feel that in all the cases medical negligence hasn't happened. At times people are at fault. At times people do not know that it was medical negligence. It just happened because of some medical ailment. What is your opinion about it?
You see, I will say a doctor and patient having a relationship of faith, working for each other, our behavior must be very good faith with the patient. And treatment is, of course, to our best possible way. In that case, you see something happens. If it is not very drastic, patient will forgive the doctor or will say that we will be coming to you. Please take care. You see, that is a matter of faith. If something more happens, then we go to the authorities as a complaint and the court will decide that it doesn't matter. But imprisonment or harsh treatments to the doctor will spoil his career and his hard work throughout the life. That is good for the society otherwise, for the nation as well. So why to be wasted by giving him imprisonment or by giving so harsh punishment that are of not going to any use? Because this imprisonment will lead to absolutely away his career. Number two, he will maybe harden criminal after that. What is the benefit of this? So other ways of punishment must be brought out which are small and quickly done in favor of yes.
Okay. So, Dr. Sahab, as per you, if a medical negligence has happened and the cases are increasing at an alarming rate. What should be the correct course of measure? Should compensation be the correct course of measure instead of an imprisonment?
Yes, you see, imprisonment I don't think is a right way for a normal doctor until like he has done a criminal activity. If I'm a family physician and surgeon, I'm doing a surgery on behalf of orthopedist or cardiologist or some surgeon, that is very bad, as is on the kidney cases, as are the detection of the sex of the fetuses in the womb. That is a very bad thing, that is criminal act. They must be punished in any way, as the authorities wish, as the court wishes. Otherwise, normal doctor must be left with caution and must be treated rather be immediately instead of immediately.
That's nice. Dr. Sahab, recently in Anuradha Saha's case, the compensation decided by the jury was 11 crores. But it took almost 15 years for the case to reach the conclusion. So, do you think that the cases should reach its conclusion at a faster pace?
You see, I think if you talk of the pace, faster pace may not be good when such a big compensation has to be given by a doctor. He will like to take the time. Compensation must be according to the doctor's standing and according to the case. And then every doctor must be given like in road cases, third party, you see, insurance has been covered. So that we can give compensation according to the coverage and according to what practice to the patient is required. You see. And compensation beyond that is not good. And you see, and otherwise, to decide the cases as is not having in any way in our courts, it must be time bound. That will be good for both of them. One who is receiving and who otherwise are also serving with a you say with a phobia in their mind. What will happen? What will happen? That will not be solved.
Dr. Sahab, how can an individual collect evidence of medical negligence? Let's take an example. If a vaccine has been given and it has resulted to severe side effects, and the doctor says that side effects have been because of the medical ailment that you've had. It has nothing to do with the vaccine that you've taken, but the individual says that it is because of the vaccine. So, how should the individual collect the evidence? Should he go to some other hospital authorities and get himself checked? Or is there any other way to talk to the doctor and maybe understand the medical reasons behind it? What's the correct way?
You see, first of all, the beauty of the doctor stands in the way. First of all, he must always take the history properly before vaccination is being done. And everything he must note down on his bad paper. If a patient is, you see, crucial in any way out, like say baby's wife, where they can be released in the future, and he doesn't listen to our, you see, treatment part, then we must keep the record properly. The government says, the authority says that record is the saver for the government. So we try to keep the records, and that records can be taken by anybody, you say, if you given. Otherwise, our consent from the patient is very important. And it must go in written.
Absolutely. Absolutely. So, my point is from a doctor's perspective, the doctor knows it. But
Yes.
from an individual's perspective, how should individual try to collect the evidence? If
See,
individual feels that there has been a medical
Individual has to talk to the doctor, how he explains, number one. If he thinks he is not wrong, he's wrong, not right, and he go to the police station to FIR. What is there? We can explain to the police person who comes that what has happened, and he will be investigated earlier, and he say earlier investigated approach. Then the thing will be over accordingly, you see. The case is there. The case is not there, that will be over there.
That's nice. So,
Many times you see these things are resolved when we talk to the patient ourselves, emphatically, properly explain the thing, and then he is satisfied. What will make that happen?
Dr. Saab, number of medical cases registered in our country are way more compared to other countries. And other countries have been able to handle their medical negligence. So, what do you think are they doing differently compared to our country?
You see, I don't know about the other countries, but I have heard their doctors are not easily available. Consultations are quite long after long periods, given for after long periods of wait. And you see here we are working for day and night. Even many times we leave our food to see the patient who has come at home, or we have to go in emergency. So in day and night we are waking up for the patient. We are visiting them in their need. None other you see discipline of life in the society will do that. Will you see wake up in the night. So doctors are definitely contributing a lot to the society, and thereby they must be obliged.
Thank you so much, Dr. Saab, for giving us your.
In healthcare system, the emotions run high. The stakes are life and death, and the margin for error is slim. What happens if something goes wrong? Dr. Praveen says that the intent of the doctor can never be wrong. So if something goes wrong, FIR should be lodged and police should investigate the matter and the doctor should be given a card. But imprisonment isn't the answer. What happens if someone loses a loved one due to medical negligence? How can that person's quest for justice be at risk? Can faith and a rigorous system of accountability coexist?